An NYU study gone wrong, and a top researcher dismissed. New York University's medical school has quietly shut down 8 studies at its prominent psychiatric research center and parted ways with a top researcher after discovering a series of violations in a study of an experimental, mind-altering drug. A subsequent federal investigation found lax oversight of study participants, most of whom had serious mental issues. The Food and Drug Administration investigators also found that records had been falsified and researchers had failed to keep accurate case histories. In one of the shuttered studies, people with a diagnosis of post-traumatic stress caused by childhood abuse took a relatively untested drug intended to mimic the effects of marijuana, to see if it relieved symptoms. "I think their intent was good, and they were considerate to me," said one of those subjects, Diane Ruffkern, 40, of Seattle, who said she was sexually abused as a child. "But what concerned me, I was given this drug, and all these tests, and then it was goodbye. I was on my own. There was no follow-up." It's a critical time for 2 important but still controversial areas of psychiatry: the search for a blood test or other biological sign of post-traumatic stress disorder, which has so far come up empty, and the use of recreational drugs like ecstasy and marijuana to treat it. At least one trial of marijuana, and one using ecstasy, are in the works for traumatized veterans, and some psychiatrists and many patients see this work as having enormous promise to reshape and improve treatment for trauma. But obtaining approval to use the drugs in experiments is still politically sensitive. Doctors who have done studies with these drugs say that their uncertain effects on traumatic memory make close supervision during treatment essential. The New York Times pieced together details of the research and the investigation through documents, letters and emails, as well as interviews with a participant and several researchers familiar with the project. Continue reading the main story. The violations jeopardize subject safety and welfare, and raise concerns about the validity and integrity of the data collected at your site, the FDA said in a letter, obtained by The Times, to Dr. Alexander Neumeister, the study's lead investigator. Dr. Charles Marmer, the chairman of the psychiatry department at NYU, said that people working with Dr. Neumeister had reported concerns about the lab's compliance with research standards. Once some of those issues were confirmed, Dr. Marmer said, the university placed Dr. Neumeister on leave, and suspended all activity, suspended access to all accounts. "I took control of those studies." Dr. Neumeister later submitted his resignation. Georges Lederman, a lawyer for Dr. Neumeister, said there may have been protocol violations, but NYU has taken the position that those violations were more egregious than we believe they actually were. "The issues could have been easily remedied," he said, and noted that they did not cause the sponsor of the research, the pharmaceutical giant Pfizer, to shut it down. Both the university and Mr. Lederman said there was no evidence that any study participant had been harmed.